It's a fascinating direction for this conversation. Public health. Where do you see as the next generation careers in for public health professionals? Uh, are governments largely still interest? Are governments largely the employers, or are there private sector employers that want to, do work in public health as well?
There's huge opportunity for both public sector and private sector. When you think about COVID, for example, there was a whole lot of role that private sector, pharmaceutical industries, vaccine producers had a big role in public health. So that might be one angle. And oftentimes when we think about public health, we think about immunizations, but that's not public health. That's one sliver of public health. But it's the whole continuum that makes and keeps a population healthy, which includes the systems and structures we have. For example, in India, we have a robust and one of the largest public health network called primary healthcare. So utilizing those kinds of network and supporting and positioning them for success is really important. So we need capacities as one. So you have a really strong education program, you have infrastructure that leverages, and then policy and governance and leadership. So you need all three elements for the public health to survive and thrive.
So what I'm hearing you say is the set of professionals in a public health system are, the patient-facing people, doctors and nurses, is only one small part of the larger system.
That's right.
What are the other professions that are sort of around in this ecosystem, especially ones that build on tech and engineering?
Right, absolutely. The big data has come in a big way, and AI, those are really important interfaces for even data analytics to inform policy change, practice change. Those are important pieces. Technological innovation. Wastewater surveillance wasn't as big. So again, huge opportunity for environmental engineers to be in that space. And so it sort of brings in domains that are not traditionally thought about as public health. And so this people with environmental engineering specialization, for example, can pivot their research interest into public health or health outcomes. So that is one example of how that positionality can be leveraged. But it can't have to do it alone. There's a number of people who are pursuing that kind of work, and looking and reading about that, getting to know about the work would help understand and carve your own pathway.